Even though I, handle these topics all the time, I hadn't heard irritable male syndrome. Now, we've talked about andropause, but again, that's so clinical. I guess what I'm saying is grumpy old men and irritable male syndrome is a real thing.
Right, it is.
Did you push record?
Thanks so much for tuning into Our Second Act with Paige and Silka. Today is our expert segment day, and I'm so happy that Dr. Laurie Blanchett is joining me again. Dr. Laurie, thanks for being back on Second Act TV.
I am so happy to be back. Thank you.
Laurie, of course, has been on the show a lot. Dr. Laurie is my personal physician, and I look forward to seeing you next week. My brain fog is like all over the board. But that's not the topic today. Today, we actually want to come to you with something that has run across my desk and comments in our videos, and that is women talking about their men all of a sudden, are becoming angry, irritable. They don't know their husbands anymore. They don't know their boyfriend anymore. And even after doing this show now for several years, I had not heard the term irritable male syndrome. Tell us about that.
Well, it's very common. And it's interesting you say that because I get this a lot. In fact, this week I had 3 husbands of my patients come in because basically they weren't themselves. And what irritable man syndrome or grumpy old men or, andropause is the medical term. And you can be 30s, 40s, 50s. You don't have to be old. But what it is you just are not yourself. You might fly off the handle easier. You might just be more moody. You feel depressed. Your motivation is gone, lack of focus. And for guys, they might notice less muscle mass, they're gaining more fat. There's a lot of symptoms, but the wives notice the mood. And the guys think they're fine because they can still have sex. But it's not true.
Yeah. So those are the symptoms then is basically, well, depression, I think, is one of them, right?
Right.
Obviously irritability. But
Right.
for some reason, we don't equate that to hormones for men. I mean, obviously, everybody knows about menopause and
Right.
mood swings, et cetera, et cetera. And that's why I think this is really important to put out there, because as I think I already said that, even though I handle these topics all the time, I hadn't heard irritable male syndrome. Now, we've talked about andropause, but again, that's so clinical. People just don't relate to that. So I guess what I'm saying is grumpy old men and irritable male syndrome is a real thing.
Right, it is. And the reason it's missed is, unlike women, our hormones fluctuate huge, okay? So think about, turning a 90-degree angle or something. It's significant. Men, they decrease slowly over time, so it's missed. They don't recognize that it's hormones, and they don't fluctuate day to day like we can. So it's very, very easy to miss, and it's common. And the irritable man syndrome makes more sense. Yeah.
Yeah, it's just aging, and it's not.
Right.
It is, and the diagnosis. I get the way to diagnosis is to blood test or get your testosterone checked.
Correct. So obviously you want to get your blood tested, and you want to make sure that it's looked at for optimal levels versus normal, because we've talked about that before. But the testosterone level is your best bet for this.
Yeah, and just to clarify, what are the quote-unquote accepted testosterone levels, and what would you, and I know you can't, offer a medical, I mean, everybody's different, but just to give a frame of reference, what would be an optimal level, what would be a normal?
For normal, it's anywhere between about 250 to about 800 as the level. But remember, they're testing the general population, most of which are irritable men, and it's too low. But optimal is testing the men who feel the best, they're doing great. That's above 700. Big difference. And anywhere up to about 1,500 to 1,800. So big difference. But yet a guy of 500 could be walking around feeling terrible or being grumpy, not even knowing he feels terrible, and being told he's normal.
Well, what is the best way then to replenish the testosterone, especially, given already, you're going to a doctor maybe that isn't a hormone specialist. How can men or the women in their lives be an advocate for making sure that they get good testosterone and get those levels up?
Okay. There's a couple options. There's creams, there's injections, and there's pellets. And the creams are something topical that you apply. And the upside of that is most doctors can prescribe it. I like the bioidentical, but they can at least get the non-bioidentical, which is close. But guys have to remember to take it, which is a problem. But it's there. The shots, most doctors will know about that and can provide that. But you want to dose it correctly so that you don't have the ups and downs. And then, of course, the pellets, we know you must go to somebody who's trained in bioidenticals that knows how to dose that and implant those. But the advantage of those is once it's in, it's good for 3 to 6 months, and it's bioidentical.
And I'll link to your information, Dr. Laurie. I know, obviously, people from all over the country and, the world watch this. So, you need to go, obviously, to a doctor near you, but you have some information on what the pellets are. Again, some of our viewers will know it's something, obviously, we advocate for a lot. It has helped me forever. But it's a little pellet that you inject into the fatty part of your hip. So I won't spend a lot of time on this segment on that, but I would urge viewers to educate yourself on that and see if this might be for you. The other treatment, obviously, again, how would this affect your relationship? It's important that women and men talk about this and be honest about what's going on, and counseling certainly, is important if you are running into relationship issues. But it may not be your first stop shop. What's the term? First stop, whatever.
First stop shop.
I'm telling you, my brain fog is. I cannot wait to get my pellet on Monday.
Basically, when things go wrong in a relationship, I would say 90% when you fix communication and you fix the hormones. I have seen marriages that were close to divorce recover and do phenomenal. I've seen good marriages go great. So working on communication, which is the counseling and other avenues, and getting your hormones balanced, why the heck wouldn't you? Because you not only feel better and you're healthier, but your relationships are so much better.
Yeah. Well, and again, that's why I'm such a huge proponent of this. Hormones, bioidentical hormone replacement just changed my life. And it's just such an important message, for me. And I think it's real important that men not only understand what happens with us. It's a lot of focus on understanding women going through menopause, et cetera. But this to me was somewhat enlightening, if you will, that we don't recognize or equate men's mood swings changes, not mood swings, but the decline in mood, the depression, the irritability, that could very well just be hormones and very fixable. So that's kind of my takeaway here. Dr. Laurie, is there anything that you would like to leave the viewers with on this topic?
I would say I've seen this in men where testosterone is the best antidepressant, better than any of the traditional antidepressants. And I've seen men, when they get balanced, that they have walked in not knowing that they were out of balance. They just knew something was off, or their wife sent them in, and they come back in their follow-up and they're just amazed because they can now work out better, their focus is better, their sex drive will enhance a little bit or a lot, depending if it's needed, but their mood, they didn't even realize. That's the shocking thing. Women always know. But it's always shocking to me that men don't realize. And then once they're better, it's like somebody who didn't have a leg and now has a leg, and they're just amazed. So definitely get it checked.
Well, on that note, I look forward, as I said earlier, to see you Monday, because I need to get checked again. And we'll see you next time on Our Second Act with Paige and Silka.
I look forward to it. Bye.
Thanks so much for watching. I hope you found this information helpful. If you haven't already done so, please be sure to subscribe to our channel. The button's right over here. And for more information about taking charge and living your life to the fullest after 50, please visit our website, secondact.tv. See you soon.